Welcome. Today we're delving into Rett syndrome, a complex neurological disorder that primarily affects girls. Join us as we explore its causes, symptoms, diagnosis, and current approaches to care. Rett syndrome is most often caused by mutations in the MECP2 gene, located on the X chromosome. This gene provides instructions for making a protein called methyl CpG binding protein 2, which is crucial for normal brain development. While most cases are due to spontaneous mutations, rarely it can be inherited. Since males only have one X chromosome, MECP2 mutations are usually more severe and often lead to early death in affected males. The MECP2 protein is a transcriptional regulator, meaning it helps control the activity of other genes. In Rett syndrome, the malfunctioning MECP2 protein disrupts the proper function of these genes, particularly those involved in synaptic plasticity, neuronal communication, and overall brain structure and function. This disruption leads to a cascade of neurological impairments, ultimately affecting motor skills, communication, and cognitive abilities. Rett syndrome affects approximately 1 in every 10,000 to 15,000 female births. It's considered a relatively rare disorder, but it's one of the most common genetic causes of severe intellectual disability in girls. It affects all racial and ethnic groups worldwide. The signs and symptoms of Rett syndrome typically become apparent between 6 and 18 months of age. Initially, development may appear normal. However, as the disorder progresses, affected individuals experience a period of regression, where they lose previously acquired motor and communication skills. Characteristic features include repetitive hand movements, such as hand wringing, clapping, or tapping. Other symptoms can include breathing abnormalities, scoliosis, gastrointestinal problems, and intellectual disability. It's important to note that the severity of these symptoms can vary greatly among individuals. Diagnosis of Rett syndrome is primarily based on clinical observation of the characteristic signs and symptoms. Genetic testing to identify mutations in the MECP2 gene can confirm the diagnosis, particularly in cases with atypical presentations. The diagnostic criteria have evolved over time, and a thorough neurological evaluation is essential for accurate diagnosis. While Rett syndrome doesn't have distinct subtypes in the traditional sense, it's sometimes classified based on the presence of specific MECP2 mutations or the severity of symptoms. Some atypical forms of Rett syndrome might involve variations in the timing of symptom onset or the presence of certain features not commonly seen in classic Rett syndrome. Currently, there is no cure for Rett syndrome. Treatment focuses on managing symptoms and improving quality of life. This often involves a multidisciplinary approach, including physical therapy to improve motor skills, occupational therapy to enhance daily living skills, speech therapy to aid communication, and medication to manage seizures or other medical complications. Nutritional support is also crucial to address feeding difficulties. Early intervention and ongoing support are essential for maximizing the potential of individuals with Rett syndrome. Because Rett syndrome is primarily caused by spontaneous genetic mutations, there's currently no known way to prevent it from occurring. Genetic counseling may be beneficial for families with a history of the disorder, though recurrence risk is generally very low. The prognosis for individuals with Rett syndrome varies, but most affected individuals live into adulthood with ongoing medical support. Lifespan may be shortened in some cases due to complications such as respiratory infections or cardiac problems. Recent research is focused on developing gene therapies and other targeted treatments to address the underlying genetic cause of Rett syndrome. Clinical trials are underway to evaluate the safety and effectiveness of these novel therapies, offering hope for improved outcomes in the future. We can see there are clinical trials for trofinetide being conducted with successful results.